Welcome to the Family Violence Prevention and Services Act program. My name is Diana Lee, and I am one of the Family Violence Prevention Services program managers. We thank you for taking the time to learn and listen to this training on performance progress reporting requirements. This training will walk you through from beginning to end on the performance progress report, whether you are new or have been working with the Family Violence Prevention and Services Act program for a while. Let's get started. This slide shares the topics that we will be reviewing throughout this training. First, we will be sharing about the background of the Performance Progress Reports, also known as the PPR. Next, we will discuss the Performance Progress Reporting Categories overview. Third, we will look at the guidance of the Performance Progress Report. Fourth, what is the Grant Solutions Online Data Collection Portal, also known as OLDC, and accessing OLDC. Fifth, the instructions of the PPR, how to submit your PPR, and finally, the additional supplemental information we will share. Reporting overview. Grantees are required by the Family Violence Prevention Services Act, also known as FVPSA, to submit an annual standard form performance progress report on their annual core FVPSA grant. These PPRs must be submitted by grantees once a year and no later than December 30th after the federal fiscal year ends. The federal fiscal cycle is October 1st to September 30th. In addition, for grantees who received the American Rescue Plan Act funding, also known as ARP or ARPA, whether it was the COVID-19 ARP funding, the sexual assault ARP funding, and or the DV supplemental ARP funding, you must also submit an annual PPR. Grantees will combine all of these ARP grants and their services all into one report. Again, combine all ARP grants into one report. This means you will have a total of 2 performance progress reports, otherwise known as PPR, that are due by December 30th. One for the annual core FVPSA grant, and one that is a combination of all of ARP grants. This training will walk you through the submission process, providing clarification and guidance for each section. So why is reporting important? The Performance Progress Report, also known as a PPR, is the way grantees inform the federal government of their major activities and accomplishments during the time frame that the report covers. The FVPSA report allows for accountability for the allowable use of funds, consistency when viewing data from prior years and trends over time, improved services for survivors through feedback to local programs about their services and the identification of enhanced service delivery needs, collection of metrics and stories for use in promotional educational materials, accurate reports to Congress on the effectiveness of FVPSA-funded programs, and advocacy of committing resources for effective domestic violence programming. This pie graph shows the percentages of the Family Violence Prevention Services Act grants to states. The reach is about 1,497 local domestic violence programs nationally. States statutorily must ensure that not less than 70% of the funds are distributed for the primary purposes of providing immediate shelter and supportive services to adult and youth victims of family violence, domestic violence, or dating violence and their dependents. States must also statutorily ensure that no more than 25% of the funds will be used for the purpose of providing supportive services and prevention services. This graph shows that approximately 80%, which is about 1,195 of FVPSA grants, go to domestic violence shelters, and about 20% is awarded to non-shelter programs that provide supportive services and prevention services. This includes state supporting coalitions and the other category, which includes cultural specific programming. Here is another example of some of the specific data fields and metrics that are used for reporting. This captures the number of clients served across the country. We can see how many clients are served nationally from each state. Whether they are shelter or non-shelter, blue represents non-shelter and green represents shelter, and by the region, including year to year, noting that the states are listed across the top, as you can see here where my cursor is. Here's additional specific data fields and metrics that are used for reporting from the PPRs. This shows two pie graphs side by side with 1 year represented from 2020 on the left, and on the right is the year 2021, sorry. This gives us a quick picture of the number of states that allocated funding to culturally specific and underserved population programs and number of states that didn't. Here's another example of how specific data fields and metrics are used for reporting. This bar graph shows how much the average domestic violence shelter funding receives through the state administering FVPSA agency by each year, shown starting from 2018 on the left through 2021 on the right. The metrics and antidotes collected in the PPRs are also used in the FVPSA fact sheets, promotional materials, reports to Congress, and as justification for future funding. Here are some examples on this slide that can be found on the FVPSA webpage. Now we will review the performance progress reporting categories. I will describe each of these reporting elements in today's presentation. You will see that throughout the performance progress report uses the term sub-awardee. I will now continue to use the term sub-awardee so we don't get confused by the language. Well, however, it is to note that when you hear the words subrecipient, subgrantee, or subawardees, these all mean the same thing. I like to suggest following along with the PPR on hand with me. We will actually view the online screens later in this training presentation when we show you where and how to input your report. You can find the PPR on the website listed on this slide above, right here where my cursor is. If you go to this website, you're able to find the hard copy, and you can follow along with that or print it out and follow along. Please pause this recording if you need to retrieve the PPR. The PPR data elements that we will be going through starts on page 2 on the handout. You will see that following the state portion labeled at the top, this is how the list of the PPR data elements overview was obtained. We will be going through each one of these. There are several PPR data elements. The subawardee list, the subawardee information portion that starts on Section A. Section B starts with people served, is where you'll find several subcategories that will need to be captured by the subawardee. Section C is the shelter services and crisis calls. Section D is services to victims. Section E is community education. Section F is narrative responses. And lastly is the service outcome data. Now let's go back and look at page 2 under subawardees. Under the state portion section at the top of page 2, you will find that this information that I'm about to read. This section is for states only. This does not include tribes. This section again is for states only. Information on FVPSA grants funds awarded should include any funds awarded by the state during the federal fiscal year reporting period. For example, if during the past federal fiscal year, which starts in October and ends in September, the state made awards to subawardees in July, then the state should report on the grants and funds awarded in July and any other funds awarded during the federal fiscal year reporting period. The state's aggregate report of services provided by FVPSA subawardees should include all services grant activities that occur throughout the federal fiscal year reporting period of October through September. You will find in the two boxes below what needs to be captured in your report. You will report total funds awarded to subawardees by the states. This means report the total amount of grant awards and contracts made to subawardees. For example, like to your local domestic violence programs, during the reporting period of October through September. For example, if the state subawarded grants to 5 local domestic violence programs, then you will add the 5 subawards and put in the dollar amount here in this first box. The next box states total amount of state administrative costs. You will report the total amount of grant funds used to support state costs for the administration of FVPSA funding. This section that is bolded named subawardee lists. Let's walk through the title boxes together. Again, remember, I am walking through this as if you were following me on the PPR document. The first box requests you to list your subawardee's program name, the city and state and zip where they're located, their website, the amount of FVPSA funding you allocate to them as subawardees, the type of subawardee they are if they are underserved or culturally and linguistically a specific population. When FVPSA is requesting the information for culturally and linguistically specific services, the definition refers to community-based services that offer full linguistic access and culturally specific services and resources, including outreach, collaboration, and support mechanisms primarily directed toward culturally specific communities. When FVPSA requests information on underserved populations, this means populations who face barriers in accessing and using victim services, and includes populations underserved because of geographic location, religion, sexual orientation, gender identity, underserved racial and ethnic populations, and populations underserved because of special needs, including language barriers, disabilities, immigration status, and age. Individuals with criminal histories due to victimization and individuals with substance use disorders and mental health issues also apply. These are also defined in the FVPSA statute that can be found at the 45 CFR statute 1370.2. Next, we will classify them as urban, rural, suburban, or frontier. If you aren't sure what is designated as frontier, you may go to this website noted www.ruralhealthinfo.org and click on Am I Rural tool. You can run a report based on the program address. If the program receives a frontier and remote area code, then you may select frontier. The next section allows you to add any notes on the subawardee here. Notes include additional explanation on other as a type of subawardee, additional explanation of the underserved population, additional description on the type of population such as refugees from Syria, additional explanation on the chosen classification for rural-urban. This is a continue of the subawardee information. This is the beginning of Section A, General Program Information. Total Domestic Violence Program Budget. This is the sum of the total annual budgets for each local domestic violence program at the same point in time. Each local domestic violence program will report its total budget that is used to provide the service to victims included in this report. This number includes additional funding from other sources. The next line captures the total amount on how much was awarded from the FVPSA grant amount listed. The FVPSA state administrator then totals each of the entries from all of their subawardees and enters the dollar amount number here. Additional information for clarity is provided here. For example, the total domestic violence program budget would include all funding sources. For example, FVPSA dollars and state dollars to provide shelter to domestic violence survivors. Services to sexual assault victims would not be included here until you create your PPR for your ARP grant if you receive the sexual assault ARP funding. In addition, a domestic violence program that is located within a larger social service agency would only include its budget for domestic violence programming. For example, a local domestic violence program that receives $50,000 in FVPSA funds, $20,000 from the state for DV services, and $10,000 for a private funder for DV services would report $80,000 as its total domestic violence program budget. This would exclude any funds outside the domestic violence program. FVPSA grant amount. Here you will list the total amount of FVPSA funds received within your current fiscal year. Next is the number of shelter facilities. This is a count of shelter facilities providing immediate housing to victims of domestic violence and their children managed by the domestic violence program. This normally includes only communal living spaces and other buildings owned or rented by the program. This number should not include safe homes, should not include motels, and/or should not include shelter beds provided by other programs. This count is the number of shelter facilities only that is property managed by the program. In the later sections, the report will ask programs to count the number of clients who were provided shelter, whether that be in a building managed by the program or a hotel or safe home. This last box in Section 8 is reporting non-shelter service sites. Lists a total number of service sites, such as office locations, where a program provides non-residential services. This may include the coordination of shelter for victims through hotels and safe homes where there is not a shelter facility. This number should be 1 if the program has a single program site with no shelter facility. If a program maintains satellite locations, they should be counted here. For example, 1 main office and 2 satellite offices should be reported as 3 sites. This is not a count of the number of hotels and safe homes used. People served. According to the PPR handout, we are now moving on to Section B, clients served in shelter. This number captures new domestic violence victims, clients, aka survivors, seen for the first time during this reporting period who received shelter services. This includes a shelter facility managed by the program, safe home, or hotel motel. Clients should be counted once, regardless of the number of times served during the fiscal year. For example, if a client spent 30 days in the shelter in November, exited the shelter and came back to the shelter in March, then she would only be counted 1 time. Clients who received shelter should only be counted in this element and not counted in clients served with non-shelter services, even though they may have received non-shelter services also. Clients who were referred to another domestic violence shelter program should not be counted here. The count will be within program only and should not be duplicated across programs statewide. Clients served with non-shelter supportive services. This captures the number of new domestic violence victims, aka clients, aka survivors, seen for the first time during this reporting period who received only non-shelter services. Include only clients that received supportive services only, and no shelter by your program. Calls to a crisis line or hotline should not be counted here and will be counted in the following section instead. Count should be within program only and not unduplicated across programs statewide. People served. Shown here is the definition for supportive services. Supportive services are services for adult and youth victims of family violence, domestic violence, or dating violence, and their dependents that are designed to meet the needs of such victims and their dependents for short-term, transitional, or long-term safety and recovery. Supportive services include, but are not limited to, direct and/or referral-based advocacy on behalf of victims and their dependents, counseling, case management, employment services, referrals, transportation services, legal advocacy or assistance, childcare services, health, behavioral health, and preventive health services, culturally and linguistically appropriate services, and other services that assist victims or their dependents in recovering from the effects of the violence. To the extent not already described in this definition, supportive services also include, but are not limited to, other services identified in the FVPSA statute at 42 USC statute 10408 B1A through H. Supportive services may be directly provided by recipients and/or by providing advocacy or referrals to assist victims in accessing such services. Oops, sorry, I skipped over that really quick. Moving on, this next section captures age. Here is where you report the ages of the clients served, including children and youth. These age demographic totals should equal the program's numbers total in clients served in shelter and clients served with non-shelter. For example, if the program served 30 women, 62 children, and 2 men, which equals 94 in total, the total for all ages should also add up to 94. In addition, in the section capturing race ethnicity, sub-awardees will report the race and or ethnicity of the clients served, including children and youth. Clients may self-identify in more than one category, for example, as white and non-Hispanic. Oops, sorry, it says white and Hispanic here. In this next section named Other Demographics, please provide the number of those needing language services, provision of interpretation and translation, and provision of English as a second language classes to be captured here. You will capture the count of LGBTQ here. This is to count the number of clients who self-identify as lesbian, gay, bisexual, transgender, queer, two-spirited, and or intersex here. The box for a number of youth aged 13 to 17 receiving services due to being a victim of dating violence is captured here. This is a count of all youths ages 13 to 17 receiving services due to being a victim of dating violence in their own relationships. These youth could be receiving services on their own, as an emancipated minor, or other minor eligible to receive services, or could be a youth who accompanies the parent to shelter and self-identifies as needing their own services. Shelter services. This is now moving on to section C if you're following along on the PPR document. In shelter services and crisis calls. This is where shelter nights are captured. Indicate the number of shelter nights for each person who arrives and is provided a bed, including on-site shelter, safe home, and/or motel hotel room. Include victims of domestic violence and their dependents. Count the number of people housed times the number of nights. For example, a victim and her 3 children stay in the shelter or safe house for 5 nights. This means 4 people times 5 is 20 shelter nights. Shelter includes on-site shelter managed by the Domestic Violence Program. Programs sponsor hotel rooms and safe homes, such as residents of volunteers who offer their private homes for short-time crisis situations or other temporary housing that your program arranges. Nights that a victim stays in a shelter not managed by your program should not be counted. Following is the unmet request for shelter count. You will count the number of unmet requests for shelter due to program shelter, safe homes, or sponsored hotel rooms being at capacity or unavailable. Count adult victims of domestic violence only. This count should not include individuals who were not served because their needs were inappropriate for the services of your program. For example, homelessness not related to domestic violence. Count the total number of times requests for shelter were declined, even if the program provided other services. In the slats box under Section C is capturing the crisis hotline calls. These are calls received on any agency line that relate to an individual or family in need of some kind of service. A program does not have to have a dedicated hotline to count these calls. Count all calls, including repeat callers and calls from third parties, such as a family member. Do not count calls about donations or for general information about program or violence issues unrelated to a specific individual or family, calls from the media, for example. In the next section, named Section D, Services to Victims, you will report the number of clients who received each service. Count each client only once for each type of service that the client received. Count the number of children and youth receiving crisis intervention. Crisis intervention is by which a person identifies, assesses, and intervenes with an individual in crisis as to restore balance and reduce the effects of the crisis in their life. In this category, report crisis intervention that occurs in person and/or over the telephone with an established client. This does not include hotline calls where the caller isn't a client receiving services. The next box is to count the number of victims receiving advocacy services. This box is identified by actions designed by domestic violence staff to help the victim survivor obtain needed services, including employment, housing, shelter services, healthcare, victims compensation, and more. Next is to count the participants that receive individual group counseling services. This is defined as a participant, whether individual or in a group counseling, that was support provided by a volunteer, staff, or advocate. Following, you will see to count the number of adults victims receiving crisis intervention, the number of adult victims receiving victim advocate services, and then the number of adult victims receiving individual or group counseling support. The last section, D, includes the count for individuals who received criminal, civil, legal advocacy. This is defined as assisting a client with civil legal issues, including preparing paperwork for protection orders, accompanying a client to a protection order hearing or other civil proceeding, and all other advocacy within the civil justice system. This also includes accompanying a client to an administrative hearing, such as unemployment, Social Security, TANF, or food stamp hearing. Assisting a client with criminal legal issues, including notifying the client of case status, hearing dates, plea agreements, and sentencing terms. Preparing paperwork such as victim impact statements, accompanying a client to a criminal court proceeding or law enforcement interview, and all other advocacy within the criminal justice system. Next, you will count the number of individuals receiving medical accompaniment. This is defined as when a staff accompanies a domestic violence victim to or meeting a victim at a hospital, clinic, or medical office. Next, you will count the number of individuals receiving transportation services. This is defined as the provision of transportation, either directly or through bus passes, taxi fares, or other means of transportation. In Section E, this is named community education, is where you will capture the number of adults and children receiving community education. First, you will count the number of presentations or trainings that was given to adults in the general population about domestic violence or services related to victims of domestic violence and their children. In addition, you will count the number of individuals in attendance. Some examples may be a training for health professionals or a workshop for tribal leaders. Include all presentations for a mixed age audience. This number does not include health fairs, media interviews, or advertising. Next, you will count the number of presentations or trainings that were given to youth that are 17 and under. These would be presentations or trainings about domestic violence, dating violence, healthy relationships, or available services for victims. Following, you will count the number of individuals in attendance at the presentations and trainings from the number of presentations or trainings provided. Some examples may be a presentation to youth in school on healthy relationships or a workshop for youth at a safety day event. The narrative questions start on page 6. I will read each of these questions with you. H01, for services reported in whole or in part by your FVPSA grant, share a story about a client without sharing any personal identifying information, service, or community initiative that could be shared with other stakeholders. H02, what does the FVPSA grant allow you to do that you wouldn't be able to do without this funding? H03, describe any efforts supported in whole or part by your FVPSA grant to meet the needs of underserved populations in your community, including populations served because of ethnic, racial, cultural, or language diversity, sexual orientation, or gender identity, or geographic isolation. Describe any ongoing challenges. I will read each of these questions with you for the last of the 3 narrative responses. H04, describe significant prevention and outreach activities supported in whole or in part by your FVPSA grant during the program year. H05, please provide on the evaluation of the effectiveness of your domestic violence programming. H06 reads optional. However, at FVPSA, any additional information that you provide to us lets us know how your FVPSA supported domestic violence program, very often than not, will paint a picture of how the programming and services are highlighted in your state or tribe. Please provide any additional information that you would like us to know about your FVPSA-supported domestic violence programs. For example, the unmet needs of victims in your community, other funding sources used for programming, or service trends that are emerging in your community. The last section of the report is to capture the services outcome data. FVPSA-funded subrecipients should be collecting outcome information from their clients served. A manual and instructions from the FVPSA funded documenting our work project are available online at the Outcomes webpage that can be found from the National Resource Center on Domestic Violence at this website provided. There are 2 mandated questions that must be asked of clients. Because of the services I received, I feel I know more about community resources, with a yes or no option. The second question is, because of the services I received, I feel I know more ways to plan for my safety, with options yes or no. State Services Outcome PPR data is reported annually as part of the ACF Health and Human Services FVPSA congressional justification. Additional information on the services outcome data collection is shared here. The outcome information may be collected for each service: shelter, support services and advocacy, counseling, and support group. However, at a minimum, FVPSA requests outcome information on shelter services from programs that provide shelter services. For each service, count the number of surveys completed and the number of yes responses to each question. It is expected that the number of surveys completed will be the same for each, but there may be instances when it differs. For example, if a client doesn't answer one of the questions. State Services Outcomes PPR data is reported annually as part of the ACF Health and Human Services FVPSA congressional justification. In FY21, states reported FVPSA outcomes for the required survey data. Of the clients surveyed, 93% share that they know more about community services, and 93.4% share that they know more about safety planning. The FVPSA performance metrics reflect shelter services data from the National Resource Center on Domestic Violence Research. In the National Resource Center on Domestic Violence, also known as NRCDV's 2009 report named Meeting Survivors' Needs, a multi-state study of domestic violence shelter experiences. They gathered information from 3,410 survivors who sought and received shelter services from one of 215 domestic violence shelters in 8 states. In 2011, the NRCDV concluded another report named Meeting Survivors' Needs Through Non-Residential Domestic Violence Services and Reports in 2011, where they captured the experiences of nearly 1,500 domestic violence survivors receiving non-residential services from one of 90 urban, rural, and suburban community-based domestic violence programs. Throughout these 2 reports, including the 17 articles reviewed for the Domestic Violence Evidence Project, the data in the articles relied on self-reports from shelter users. Most were small studies, but 2 large studies surveyed 368 shelter residents in Canada, and 1 study surveyed 3,410 shelter residents in the United States. Both studies surveyed women at the shelter during entry and exit. As a result of the survey studies, evidence of domestic violence shelter findings reported they were feeling safer and having more safety strategies, feeling more hopeful, knowing more about domestic violence and its effects on themselves and their children, feeling more efficacious, feeling less isolated, fewer trauma-related symptoms. The conclusions drawn from the domestic violence evidence projects that evidence exists that domestic violence programs positively impact numerous factors predictive of well-being for domestic violence survivors. Shelter users report feeling safer, more hopeful, and possessing more safety strategies as a result of their shelter stay. Advocacy services lead to women experiencing less violence over time, less difficult accessing community services, increased social support, and higher quality of life. The DV Evidence Project is led by the National Resource Center on DV, on domestic violence. This online resource center houses a comprehensive evidence review of domestic violence core services, programs, and innovative practices, including the review summaries and a conceptual framework for domestic violence services. The project can be found here at this website, www.dvevidenceproject.org. Thank you for continuing to stay with us for this training module, the FVPSA Performance Progress Report. In this next section of this training, we will start to look at the Grant Solutions Online Data Collection Portal, also known as OLDC, and where to go online to enter and submit your report. Throughout this training, don't forget you can rewind, pause, or fast forward as needed to review the sections that you would like to see. Let's continue. Here's a web link again to find a hard copy of the PPR. This hard copy is beneficial when sharing with sub-awardees what is required for the FVPSA Performance Progress Report, also known as PPR, since the online report is only available to states, tribes, and territories as grantees through Grant Solutions. FVPSA programs to report. There are two PPR. The annual core FVPSA PPR and the ARP PPR, which includes the ARP DV supplemental, ARP COVID-19 testing, and the ARP sexual assault grant funding. To share again that the ARP PPR cannot be combined with the annual FVPSA core funding report. All grantees must submit a separate PPR for each of the two types of grant award receives. For example, the state of Alabama will have two PPRs for FY 2022, one for their annual core FVPSA award and one for their ARP Act awards, which is a combination that includes the ARP DV supplemental, ARP COVID testing, and the ARP sexual assault grant funding. The format of the PPR is exactly the same for both. The report name is the Annual Report FVPSA PPR in OLDC. For both, make sure that each report covers all the activities for that program and fiscal year. The ARP PPR will likely have different reported values than the core PPR. Only one PPR must be completed for the ARP funding. Separate PPRs do not need to be submitted for each of the three programs under ARP. PPRs are captured by these reporting periods, also referred to as the federal fiscal year. Reporting period equals federal fiscal year, which equals October 1st through September 30th. An example is shown here. FY 2022 equals October 1st, 2021 through September 30, 2022. The deadlines for the core PPR and all of the ARP Acts are both due on December 30th. The reports will conclude activities conducted from October 1st through September 30th. Please make sure to check the number of submissions completed for a particular program and that the PPRs have been submitted for the correct fiscal year. Grantees should only have one final submission for a given program and fiscal year. A reminder about confidentiality. The survivor's confidentiality and safety are paramount. Do not provide personal identifying information, also known as PII, or personal health information, also known as PHI, in the performance progress reports. Anecdotes about individual clients are permissible and encouraged in the narrative questions. However, please exclude names, and PII and PHI need to be omitted. Steps should be taken to protect privacy. For examples, names should be changed and any potentially identifying demographic information should always be omitted. The Online Data Collection Portal, Access, also known as OLDC. Please log into Grant Solutions to follow along if at all possible. This will support repetition and getting more hands-on with the Grant Solutions OLDC portal. The website to Grant Solutions OLDC is shown above. It's shown here, excuse me. You will log in with your username and password and click Submit. Here are some screenshots shown here to provide visuals of what your screen should look like when starting to enter into Grant Solutions. When you get to the screen on the web page, you will find the name Online Data Collection selection shown at the top of the screen in the right-hand corner. It is shown here highlighted in a red outlined box. You will click on this, please. You are welcome to pause at any time of this training to do what you need to do online. Now we will enter the PPR instructions online. On the left-hand side, or sometimes even the middle of the screen, you will find this menu here. I am circling it here with my cursor. You will want to make sure you click on Report Form Entry, where this red box is. Oops, sorry, I jumped pretty quick there. Once you click on Report Form Entry, you will find 3 menu bars: Program Name, Grantee Name, and Report Name. Please click on the first one labeled Program Name as shown here. You will see that there are 3 reports to choose from. The first one shown here is the Core Annual FVPSA Grants for States, Territories, and Tribes. The second is the American Rescue Plan Act. And third is the CARES Act, in which the funding has expired, and all reporting for this should have been completed. If it has not, please reach out to your federal project officer. For now, you will select and click here. Next, you will automatically be taken to the next menu bar in the middle named Grantee Name. You will find and select your state, territory, tribe here. Please make sure when you are making the selection that you also select your grantee name with the most recent end date in the listed year range. The order and spelling of grantee names can be changed significantly between grant cycles, so it is important to check the correct one is selected. Once you select and clicked, it will bring us to the third menu bar automatically. This last menu bar is named Report Name. You will want to make sure you select Annual Report FVPSA PPR. You will find that you will go into the core and the ART PPRs, and they will look the same in terms of the naming when you're under this report name menu. Please click on this selection with the red arrow shown. When you finally make the third selection from all of the 3 menu bars, it will take you to the screen and it should look like this. This has all the reporting periods in chronological order from present going back, which runs October 1st through September 30th. This table may include old PPR submissions, as you can see here, or blank future submission, also shown here. An empty report status indicates that the report has not yet been started. Consider clarifying, listing out what the different report statuses mean on this slide. The selection shown that is highlighted in red is the current year you will be working on, since the federal fiscal year just ended on September 30th. You will be completing and submitting a report for October 1st, 2021 to September 30th, 2022. The symbol shown here that has a red outline box means that you can view the latest report. The printer icon image next to the left of the eye symbol means you can print your report. The symbol that I'm pointing here with my mouse is the report status of your report with the black arrow down here. And lastly, the icon with the pencil on the paper here with the yellow arrow pointing to it means that you can edit your report once you have started your PPR. As we go through this report with screenshots shown, we want to first outline what the sections of the PPR will look like. There will be 3 sections that you will see on the next page and also shown here. The first section is what we call the cover page. This has important information identifying who the grantee is, such as your name, your address, report dates, and etc. The section below here that I'm showing here with the cursor, this is to be completed by states only. You will also see on the image on the right hand, the blue and purple sections are required by all states, tribes, and territories to be filled out. The yellow section is for states only. This is just another way to look at the PPR from a high-level overview. The FVPSA grantee portion is to be filled out by all grantees. This is reiterated again here on this screenshot of OLDC, where tribes only need to fill out these 2 sections: cover page and FVPSA grantee portion. Again, please make sure that you are in the correct report by clicking this box up here. By checking, I'm sorry, not clicking. So you'll just make sure here. This is reiterated again here on the screenshot of OLDC, where tribes need only to fill out these 2 sections. Again, please make sure you are in the correct report by checking this box up here. To start, under the Perform action, you will click on Select Action as you move your cursor up and down. It will highlight the section in blue like it is shown here. Click Edit Section and then click Go right next to it to start entering the page where you can view and start entering the information. This is what the cover page should look like. You will find several boxes below that are outlined in red that will help guide the training on where to look for the items I am discussing. You will continue to see throughout the screenshots to support your learning, and this will help where to look for these on the reports. The first page overviews who you are as a grantee, providing us with your basic information. Look at the first box on the left, label 1. You will see that the font in this heading is blue. This means you can click on this heading to view additional information on context about each entry. The cover page includes several important boxes that need to be checked. Please ensure that your DUNS, EIN, and UEI numbers are correct. Please make sure that it has the most recent DUNS and EIN and possibly UIE number in there. Do not put spaces, dashes, or special characters in the field. Further information on how to get these numbers or updates your numbers are shown here on these websites. For EIN, it's www.irs.gov. For your DUNS or UEI, it's www.sam.gov. Make sure your organization information is correct in all of the boxes under 4 and that your grantee name is the same as last year's unless you officially changed it through sam.gov. You can skip box 5 and make sure to enter these boxes labeled 6A and B, the grant project period, start and end date format like shown here. Here's an example from Alabama. If you look to the right of your screen, you will see what I just discussed. Box 3A is your DUNS number. 3B is your EIN. Do not put spaces or characters, special characters in this field. Box 4 here is the name of your organization. Use sentence case for all names except state abbreviations. Make sure that it is consistent with previous year's data, unless the grantee name has officially changed. If the grantee's name in last year's PPR was Alabama, this year's PPR should also be listed under the grantee name Alabama. So skip here, 5, skip, but you will go to box 6A and 6B. Grant project period start date, project grant period end date. The rest of the cover page shows in box 7, the reporting period end date, box 10, performance narrative, box 12A and B, the name and title of your authorized certifying official. Here's the screenshot here, what I just shared. And box 7, the reporting date, the reporting ending period date. Box 10, performance narrative, where you can add an attachment. And then box 12A and 12B is the name and title of your authorized certifying official. On box 8, yes, you will click yes and mark it final report. And on box 9, you will make sure you click annual. So for report or frequency, this is the annual. And again, FVPSA only does annual reports. Only state grantees should complete the state portion. Click on Select Action and highlight Edit section and then click Go. Again, says Section SP, State Portion, States Only. As state grantees, you will see the subawardees section here. If you have new subawardees to add, you will click on this button shown here. However, if you did a PPR last year, what OLC does is it carries your subawardees from last PPR and brings them to this new PPR. We will show you all that shortly, what your screen will look like. Once you start to enter information and date into fields, please make it a worthy habit of clicking on Save at the bottom of the screen. Here, where I'm pointing my cursor at, because we can get distracted by a phone call, email, or anything else, and it is important to make sure that we are pressing save. You can start your PPR, and if you did not complete your PPR, you can save the information and re-enter at a later date. This is also what the save button is for. Again, if you do not happen to complete your PPR in one sitting, you can save it and return it at a later date. Here is where the total funds awarded to subawardees by the state is inputted. This is the sum of the funding amounts provided to state subawardees using FVPSA program funds. It should not be reported as $0. The total amount of state administrative costs is the total amount of grant funds used to support the cost for the administration of subawardee funding. To ensure your math calculation is correct, the FVPSA funding amount plus the total amount of state administrative costs should equal the FVPSA grant amount on your notice of award. The subawardees listed here are carried over from year to year. If you are new, you won't have any here. You will want to edit the subawardees that were submitted from the prior year if you have made new awards to new subawardees. Always check the list to ensure the information is correct, even if you believe all the subawardees are the same from last year. To edit the subawardees, please click on this button on the right-hand side under Action. When your cursor hovers over this pencil on paper symbol, it will say Edit, and you will click this. This is what it looks like when you open up and the Edit button on the for subawardees. You're able to revise subawardee information including web address, classification for rural urban, funding amount, culturally specific categories and notes if needed. You can also add in the FVPSA funding amount. Edit or add in the FVPSA funding amount. You should always have a dollar amount here unless you do not know at the time of filling out the form. If you do not know, leave it blank, save, and come back to it. Please repeat for each subawardee. We ask grantees to do not enter zeros in this FVPSA funding amount section. As we continue to look at the state's only subawardee section highlighted by the red outline, if they are underserved and or culturally and linguistically specific populations program, please try to map the populations accordingly to the following categories listed in this box on the right-hand side. Please make sure to use the exact spelling and space as noted in this box. If more than one applies, please list them out and separate them by a comma. If the subawardee did not serve a specific, culturally specific, or underserved population, please leave it blank. Do not write none. Do not write NA. Do not write underserved. Do not write all. Again, leave blank if the subawardee did not provide a culturally specific or underserved population. To move to another section on this report, there are a couple options on how to do that. One option is that you can click on this section in the header noted in the red outline box above. The second option is to navigate to the next section by clicking this darker blue box named Next Section. The last section that we're reviewing is the FVPSA grantee portion. However, a much more expanded section than the other two. Here is some general guidance for quantitative fields that you will run into once you start entering in your data. For any empty zero value data, when the number of clients, shelter nights, presentations, participations, or other pieces in this PPR is precisely 0, please enter a value of 0. If no data was collected for a given field, please leave it blank. If a number must be suppressed for data privacy reasons, for example, low counts that can identify an individual, add it to the not specified other or unknown metric. Make sure all values are positive, 0, or blank. Enter numeric data without commas. For example, 1234 instead of 1234. We discussed this section earlier in the presentation when we were reviewing the hard copy PPR. This is what it looks like online in OLDC as the PPR. This first box here listed under Section A is the total domestic violence program budget for the grantee as a state, tribe, territory. For example, if each subawardee from local domestic violence programs report a dollar amount here, you will add all of those up and put that dollar amount here from the same point in time. The FVPSA grant amount should always be no more than or less than the notice of award. It is the total grant amount from FVPSA under this program. For states, however, the FVPSA grant amount should equal the sum of funds awarded to subawardees plus the total amount of state administrative costs, which then would equal the total of the notice of award. Grant awards are published publicly on the FVPSA website. These numbers may be used for validation. You can find the website listed here. In Section B of the FVPSA grantee section is where you will start to enter clients served in shelter and non-shelter. Please make sure that any numeric entries are blank, 0, or a positive number. Please make sure there are no letters and symbols in these numeric sections. For fields that include a not specified, unknown, or other category, for example, for age, unknown adult, and unknown child, please count individuals where the age is unknown. If unsure whether to count the individual as an adult or child due to unknown age, count a dependent as unknown child and all others as unknown adult. For gender not specified other, please count individuals where the gender is unknown or does not map directly to one of the categories, such as non-binary. For race ethnicity, unknown or other, please count the individual where the race is unknown or does not map directly to one of the other categories, such as 2 or more races. In this section C is shelter services and crisis call. This is where shelter nights are captured. Indicate the number of shelter nights for each person who arrives and is provided a bed, including on-site shelter, safe home, and or motel hotel room. Include victims of domestic violence and their dependents. Count the number of people housed times the number of nights. For example, a victim and her children stay in the shelter for safe house for 5 nights. This means 4 people times 5 nights equals 20 shelter nights. Shelter includes on-site shelter managed by the Domestic Violence Program, program-sponsored hotel rooms, and safe home. For example, residents of volunteers who offer their private homes for short-term crisis situations or other temporary housing that your program arranges. Night that a victim stays in shelter not managed by your program should not be counted here. The last section, D, includes a count for individuals who received criminal civil legal advocacy. This is defined as assisting a client with civil legal issues, including preparing paperwork for protection orders, accompanying a client to a protection order hearing, or other civil proceeding, and all other advocacy within the civil justice system. This also includes accompanying a client to an administrative hearing, such as for employment, Social Security, TANF, or food stamp hearing. Assisting a client with criminal legal issues, including notifying the client of case status, hearing dates, plea agreements, and sentencing terms. Preparing paperwork such as victim impact statements, accompanying a client to a criminal court proceeding or law enforcement interview, and all other advocacy within the criminal justice system. Next is counting the number of individuals receiving medical accompaniment. This is defined as when a staff accompanies a domestic violence victim to or meeting a victim at a hospital, clinic, or medical office. Next, you will find you're counting the number of individuals receiving transportation services. This is defined as the provision of transportation, either directly or through bus passes, taxi fares, or other means of transportation. When entering fields in Section F, the narrative section, enter all text directly into the boxes in OLDC. I will offer a tip for the narrative sections. It is best to start your draft in a Word document. Then you are able to cut and paste your responses into these boxes. Once you have completed your narrative section, then you just have to, again, make sure you cut and paste from your Word document. This will make sure it is much easier than typing in the boxes. You must ensure that after you cut and paste that you go through the text to make sure there are no grammar and spacing issues. Responses can be added in a file attachment, but the text should also be copied into the text boxes. FVPSA will not accept just a file attachment. There must be text in the boxes. If you want to upload an attachment, please do not upload text responses as scanned PDFs or image files. Scanned documents and images are not 508 compliant, and it makes it much difficult to search and review the attachments. We highly recommend either attaching a Word document or an actual Adobe PDF. In Section F, as additional tips for crafting responses, please avoid formatted bullet points, special characters, accented characters. If names rely on special or accented characters, remove accent marks or spell phonetically. For example, names like Jose or Zoe. This section is quite important. Narrative responses allow grantees to provide additional details about accomplishments and challenges that are not captured by the numerical data. Please provide enough detail to fully answer each question, including 1 to 3 anecdotes or client stories where appropriate, while keeping answers concise. Thorough but concise responses help FVPSA to better understand the work of grantees and justify continued funding to Congress. It is helpful to include explicit references to culturally specific or underserved groups, allowable use of funds, innovative projects, and service provisions for domestic violence survivors. If no response is being provided for a field, please leave it blank. Do not write out NA or no response or none. However, the federal project officer will more than likely reach out to you if the narratives are left blank. Finally, we come to the last section, service outcome data. The outcome information may be collected for each service, shelter, support services, and advocacy, counseling, and support group. However, at a minimum, FVPSA requests outcome information on shelter services from programs that provide shelter services. For each service, count the number of surveys completed and the numbers of yes responses to each question. It is expected that the number of surveys completed would be the same for each, but there may be instances when it differs. For example, if a client doesn't answer a question. State Service Outcomes PPR data is reported annually as part of the ACF Health and Human Services FVPSA Congress justification. The percentage section you see here that's highlighted in the red outline box automatically calculates your number of surveys completed and the number of yes responses to resource outcomes. You will want to review the percent here to ensure that it looks reasonable and is 100% or less. Hopefully you've been saving your data throughout inputting your data and information in the PPR. You will save again and then you will click Validate here seen at the bottom of the screen. Congratulations, you are now ready to submit your PPR. Let's continue. You will now return to your report sections at the top of the screen shown here. Go to Report Sections. It will bring you back to this page. Make sure to look at the right-hand side where it states Section Status. Make sure it looks like it does here when it states Saved, Validated. Once you verify that it is saved and validated on all three sections, you will click on Certified. A pop-up box will come up. Please read the box and you will click OK. This is part of the certifying process of the PPR. What it will do is once you click OK, you will need to sign the form following clicking this button. It will bring you automatically to this page to sign the report. Please click to sign box shown here. After you click on the sign button, your display should look like this, noting e-sign. At the report progress bar, note that the report is now in certified status. Go to the header and click on Report Form Status. There are a couple more steps to finalize the submission of the PPR. Here you will see in this red highlighted box is a button that says Submit Report. Please click on this. A pop-up box will come up and ask that if you press OK, it will officially submit your report. Do you wish to continue? You will press OK if you're ready to submit. Press Cancel if you are not. Now when you look at the report status, it states it's been submitted. When you go back to the report sections, you will see your report attachment above. There are several options to save a PDF version or print a copy of your PPR. You can either click on the attachment under File Name, shown here with my cursor, or a better option is just by clicking the button labeled Print Full Report, which is here. So you can have this option here and click on that to open the report, or just press Print Full Report here. This will automatically create a PDF PPR for you, and you can save a PDF version and or print. There is also another option to print as well. This will allow you to print the report as well as all the attachments associated with this report. Anytime you need to make revisions or corrections, or is asked to make revisions or corrections by your FPO, Federal Project Officer, you will need to log back into OLDC and make the changes there. You will see the pencil and paper symbol there. When you hover over it, it will say Edit. You will click there to make the necessary changes. It is important to make changes in OLDC since submissions made to FVPSA staff via email may not always be accurately captured in future reporting. In addition, an official record is created when documents when you go in and out of your OLDC and your PPR to make edits and revisions as necessary. There's a timestamp which helps let us know the last time you were in OLDC. Supplemental information. Here is some additional information to get access to grant solutions if you do not have access, or where to go when you go onto the web page to get into grant solutions. If you don't have access, please contact your federal project officer right away. If you do not know who it is, please use the following slide's email shown to reach out to them. To enter your data into Grant Solutions, again, here is the website. If you need help by phone or email to get Grant Solutions, please reach out to the phone number list or email shown. Here is a slide here is a slide of the general email boxes to the 10 regions noted here. Next is a resource list. FVPSA highly encourages you to visit the ARP Grants portal. This portal contains important information on the following, such as technical assistance and tools, including FAQs, drawdown information, allowable costs, tribal resources, new initiatives. The learning portal includes financial training modules, program guidance, including instruction memos, FVPSA news break, FVPSA podcasts, FVPSA newsletter, and regional contacts. We'd like to thank you for your incredible work throughout your tribes, states, and territories, and we look forward to supporting you in your work to end domestic violence. Again, please pause, rewind, and fast forward this training as you need. And thank you for taking the time to take this training today.